Okay, this is my newborn pass off. So we get handed the baby. So the first thing I'm gonna do is just grab the baby, gonna dry the baby, get all that stuff off of them, and make sure that they are warm, and we could put them in the little warmer thing as well. So now that the baby's all dry, I'm just assessing like their color, movement, tone, reflexes, everything like that. Then I'm gonna go ahead and do my APGAR score. I'm also gonna put gloves on. I also, before I do any of that, I want to make sure to put my ID band on my patient after drying them off, just for safety reasons, to make sure we know who our baby is and make sure that they're in the right spot. Okay, so once they've been identified and everything, the APGAR score at 1 to 5 minutes. So I'm just gonna do the mouth and then the nose, suction, making sure that their airway is clear. It looks good. We can check some of their reflexes, like the palmar grasp, tickle their feet for the Babinski one, and like startle them, and their hands will go back and everything like that. So that looks good. Then I'm just gonna do vital signs. Just put that underneath their arm and get all their vitals. They look good. And her APGAR scores were an 8 minute, or they were an 8 at 1 minute and a 9 at 5 minutes. So this baby's good. I'm gonna check her length and see how tall she is. Looks like 19 inches that way. And then we can do their head circumference. There we go. Okay, 45 centimeters. And then also going to just check their chest circumference as well. Measuring all that, making sure it looks good. Okay, 40 centimeters. Alrighty. And then I also am gonna just take baby and weigh the baby. Okay, good. It looks like your baby is 7 pounds today. So awesome. Okay, then I can go ahead and I'm gonna administer my eye ointment for my baby, just putting it on those eyelids. This helps to prevent any like infection or bacteria or STDs that might have come through with the vaginal canal. And then we're also gonna give baby vitamin K because their blood clotting factors aren't really there, so we just give them this to help with that. Scrub that for about 30 seconds. Okay. Draw it up, doing 0.5. So let's do that. Okay, there we go. Then just wipe the skin. It's gonna be right here in vastus lateralis. Just put it in. Okay, perfect. Good method. Okay, now that our shot and everything is done, I'm just gonna go ahead and I'm going to assess the baby's spine. I wanna make sure that it's located in the right spot and that there's no like hair or signs of spinal problems in the back, but she looks really good. And then I'm just gonna assess the fontanelles, looking for that anterior fontanelle, making sure it's not bulging or sunken, but that it's soft and that looks good. Looking for any signs of like hematoma, looking for any like blood and any abnormalities. So it looks really good. Then I'm gonna assess the ears, make sure that they're symmetrical. Looking at the nose and the lips, I want to check baby's sucking reflex and to make sure there's no like pearls or anything in the mouth, so I'll just stick my finger. Okay, looks good. Looking at the eyes, making sure there's no problems there. Looks really good. And then with the neck, we're just going to assess range of motion and also feel that clavicle, make sure there's no crepitus or any injury present. Okay, the baby looks really good and healthy. Then I'm just gonna go ahead and listen to the heart and lungs. I listened to this for about a minute if I was doing it in real life, so I'm just gonna listen to baby's heart rate, make sure there's no problems there. Okay, and also the lungs. I could also just check the back. Okay, that's good. And then I can check pulses as well on each and just make sure that everything sounds good. I'm gonna check cap refill, just get a little press. Great, looks like it's less than 3 seconds. I want to assess the abdomen and umbilical area, making sure that umbilical cord has 3 vessels. And it looks really good, there's no problems. The abdomen is good. I can also listen for their vowel sounds, and I would record their meconium once it passed and everything. Okay, looks good. Assessing the genitalia, looks like it's a girl, so that's great. Making sure there's no abnormalities present in that area too. And baby looks really good, no problems. And those reflexes, just feeling it. The baby is good. And I'm just gonna ask the mom about her feeding, how baby is doing with that. Is baby doing okay so far with feedings? Great, okay. And she's been able to suck, so that shouldn't be a problem when we get there. Yeah, just gonna swaddle baby, make her feel comfortable, and she's good to go.